I wanted just to share some details in the way of a case study for a recent interim leadership engagement that we just wrapped up. Actually, at the start of this project in the Women's and Children's Division, I had an interim CNO in seat as well. Through part of her initial assessment, she identified the need to transition the current Director of Women's and Children's Services out of the role. So we engaged a very seasoned, proven interim leader from HealthLinx that I've had the opportunity to work with many times in the past, truly an expert in the field. And we launched this project initially at 4 months and for a 4-month period of time. In the end, though, it ended up being a 10-month project as they asked for a 6-month extension. As we normally do in all of our interim leadership projects, we look at project priorities. And at the top of the list, there were some quality potential safety issues that needed to be assessed and addressed. Most of these things, I would say, were process related. So, really finding that they weren't following best practices, they weren't utilizing A1 guidelines. And so there were a number of process issues that she was able to pretty quickly put into place. One other area that she identified was that they really didn't have quality markers. So she was able to develop a quality dashboard in conjunction with the CNO and the quality department there. So this gave the staff and the department at least, some goals to target and really help them, planning their daily work. So that was a big win for them as well. Another area of concern was the staffing and the current staffing model. And she identified that, they were lacking in staff. They needed to do some hiring. And throughout the engagement, she was able to hire in about 15 permanent RNs, in addition to some support staff for the department. And because of that, she was able to discontinue some traveler contracts. In total, I think about 5 traveler contracts she was able to discontinue. And we do know that, annualized, that's a pretty big cost savings for the organization. So really probably rounding out about savings of about $500,000. They were also working toward the launch of a new pediatric unit, which was very exciting for them. This was a heavy lift. So, our leader was able to hire in for the department. She was able to just really help with some last minute, areas of need in the department and the structure of the department, in addition to really, formalizing the onboarding plan and what did that look like to bring pediatric nurses in the way of competencies as well and education. They were also transitioning their EMR to EPIC. She was able to provide some good information and knowledge about the build, and then ensuring that all of the staff was adequately trained prior to their go live. And they had a successful launch of their EPIC EMR. HealthLinx was also able to source and identify a perm leader for them that they ended up hiring into the Director of Women's and Children's. So the leader came on at a point that we still had about 2 months left in the project. So we were able to provide a pretty robust transition and handover from the interim leader to the perm leader, which again gave her a good start, a good foundation, and ensuring that she was set up for success.